enough to have with us Dr. Amir Hamzah, a specialist in the area of allergies and one of the leading voices here in Malaysia in terms of the whole vaccination rollout, joining us today on a working lunch with Nordin. Dr. Amir, thank you for joining us.
You're most welcome, Nordin. It's a pleasure being here. How are you?
I'm good. I'm good. How are you? How are things? I know you're. It looks like we're dialing into your office right now, into your clinic.
Yes. Here, my clinic in Pantai Hospital, Kuala Lumpur. Yep, that's where I am now.
Okay, great. And Dr. Amir, there's been, of course, COVID-19 is the global conversation right now, and the whole vaccination rollout is kind of top of mind for everybody. Can you give us an idea what? And we kind of package this show as the state of play in terms of vaccination and the whole COVID-19 reality here in Malaysia. And also we could discuss what's going on globally, but what is the state of play in terms of vaccination in Malaysia?
Yeah, I think since it was first rolled out back in February 24th, right, when the Prime Minister was the first to have had a shot. And since then, I think the initial stages were just mainly for the frontliners, so the so-called phase one. So that came out to about 500,000 of us. And basically, we're looking at those in the healthcare. And so that was basically the Pfizer, right? And it was only until 18 March when the Sinovac came into play. And when AZ was meant to roll out, but unfortunately with the scare or the concerns, I think, of the very rare side effects of AstraZeneca or AZ, that they pull it out from the actual immunization program. So we have, I think, if you look into the National COVID Immunization Program, NCIP, or in the Malays, PICK, PIC, then you will see that there are 5 vaccines, right? So besides the 3 I've just mentioned, there's CanSinoBio, and there's news that will be coming pretty soon. And the advantage of that being a one-shot vaccine rather than 2 shots, right? And then there will be the Sputnik V. Words on that, but those were 5. So see that AZ was opted out, and I think the first people who did get the into that option was on the 5th of May, right? And then there was a second round. So and then that was phase 2. Those were above 60, and then phase 3 just recently last Monday, right? So it's been a week into the phase 3. So all in, I think it was pretty slow, I have to say, right from the beginning. And I think people were just trying to move around, look in the logistics, and trying to be familiar and trying to troubleshoot and look at other things that need to be, addressed. It was probably a bit easier with the frontliners, but the minute it was opened up to the public, yeah. So and then we have the PPV and the mega PPV, the vaccination centers. So then there'll be a lot of concerns about even those mega PPV, aiming for even up to 10,000 shots per day. Are they able to cope? And what about the facilities in terms of the if there was any problems? Particularly, I think the other anaphylaxis, which is a severe life-threatening allergic reaction that was reported with Pfizer, right? So then people are concerned, hey, is there resuscitation facilities? And I have to say, it will have to be there, right? I mean, if you're going to deal with somebody who can potentially go into an shock because of anaphylaxis, then you'd have to have at least the basic medication, which is the treatment of choice, adrenaline, to be given intramuscularly. So I am going to be very confident that there has to be the case. Although I am not an inspector of this PPV and to ensure that everything is there. But I trust the Ministry of Health to have. I believe they have outsourced this to private clinics, big companies, and to get people to run it. So they will have the volunteers, and then they will have people, the usher, to direct people, and then they will have the medical officers, and then the vaccinators, and then people who are dedicated and looking into the observation. There is going to be resuscitative facilities, medications, if the need arises.
Mhm.
So yeah, so I think we should be confident that everything is in place when all this
Yeah.
has been set up.
This was my
So
question.
that's my
Should people? Yeah.
simple long dragged answer for your
Yeah. No.
auditing how things are going on. But I think if I remember correctly, those who have had the first shot, I mean, I only look at the numbers periodically, but it's all available publicly anyway. I think it's more than 16% now of a first dose, right? And I think
Mhm.
16% is of the 32 million, rather than what I probably look
Mhm.
at the 24 million. I was looking at 24 million, those above 18 years old in the
Mhm.
first instance. But now that they are saying that 12 and above, and that I suppose that's another thing we have to talk about as well. But
Mhm.
60% of the 32 million has had the first dose, and I think more than 6%
Mhm.
now completed the two doses. And I think that now
Okay.
recently would have included those second dose of the AstraZeneca, because I just had a patient yesterday who came in and said that, oh, we just had our
Mhm.
second dose of AstraZeneca yesterday. So they were the first that had it on the 5th of May. So they just had it yesterday.
Okay. There's a lot of. I got a lot of questions myself, and I know there's some questions that have started to come in. When we talk about which number of the Malaysian population, I know there's the Malaysia's population, but there's also the resident population. There's several million foreign workers here from various. Is
Yeah.
this factored into the equation? Because we saw quite a few clusters in industrial sites which were predominantly foreign workers. How is that rollout? And because there's another rollout also, isn't there, for the corporate sector? What are you seeing there? And from a company's perspective, what should the companies be thinking about in terms of getting it right, in terms of that potential rollout for a program in a factory or an office with a few hundred or a few thousand people?
Yeah, I think this is why I think I look at it. Probably we have to divide it into two now. Initially, I was looking at the phase one, two, and three, and I felt that even though we always talk about those the elderly and the comorbid condition, people who have comorbid diseases being a priority to get it, but when you look at it as well, and this is where the whole thing about looking at the vaccination and about the cases that we have, we'll have to look at the logistics, and of course, don't forget about the supply, right? I think there's a big debate or rather concern about the supply is not coming in fast enough. And so if I look at it initially when it was phase one, two, and three, it was clearer, right? And but I thought that at some point there were many people that are moving, those are working class. So they would be moving through inter-district, interstates, and they will be the one bringing back, potentially being exposed and bringing back the potentially the virus into the house. So why shouldn't they be the ones first? And these are the ones in the 20s, 30s, 40s, but they have to wait because they are phase three, whereas we were trying to get those 80s, 70s, and 60s coming down, and now we're down to the 50s and 60s. Why don't we just get
Mm-hmm.
everything and all into one phase? And those who have
Mm-hmm.
first come, first serve, essentially. Because this is where the hesitancy came about and the frustration amongst the public, because those who have been waiting and waiting and still waiting are not getting that. And they
Mm-hmm.
begin to rationalize that if they don't get it, then they will bring it back home. So I think that makes perfect sense
Mm-hmm.
that we just don't look into. But of course, we are now into phase three. So let's see how they play it out and whether they are going to
Mm-hmm.
do those 20s and 30s first rather than going by the age group. First come, first serve. I think that's the simplest. And I think the other mechanism that we could look into, because I think things that have been happening with the MySejahtera and the frustration about the efficiency of that, and a lot of my sort of friends and acquaintances would tell me, hey, why don't we just do something like a general election style, right? We go by the electoral
Mm-hmm.
roll, go through the schools. Ventilation will be better there, open space. I
Mm-hmm.
mean, the rooms and the doors are all open. So, that's begin to be important, right? I mean, that's why, in a way, they're making sure that the mega PPV, where people are in and out of the place less than an hour, all right? Because the ventilation, sure, is big, but it's still a closed space.
Mm-hmm.
Whereas we are doing it as a general election. Imagine they could get what, 11 million in a day. But we can
Yeah,
only
exactly. I
say
was going to
that
say
if
12
we
million.
have
Yeah.
yeah, if we have enough of the doses. So we have to be mindful about that. So that
Mm-hmm.
would be a lot of things that we are doing, and I know the ministries are doing it, mobile, going now to the people. So let's say that everyone is trying to do their level best. I mean, we have to take that positive vibe and be positive about everything. I know we can't be just complaining about things, right? It'll be no end to that. So
Mm-hmm.
let's
Mm-hmm.
just take it as it comes. And now with the corporate right now, I know a bit long-winded I'm saying, but I'm just putting everything into perspective.
No problem. You got it. It's a difficult subject, so there's
Yeah.
a lot of
So that's
detail that needs
where
to go into this.
Yep. So that's where then suddenly I look into the program and there's a phase four and I say, hey, what is this phase four? And it's actually basically for the corporate, for the companies, right? For where the factories are, and then factories meaning that the foreign workers. Have we really put that into the equation? I wouldn't know.
Mm-hmm.
Seriously, I'm not privy to this
Yeah.
sort of information. So, but we would
Mm-hmm.
have thought that maybe they're not, because they're non-citizens, right? In that sense. But if we say that and we know that what those that are registered, how many do we know? 2 million, 3 million, 5 million extras, those
Yeah.
registered, and that's where we have to be putting and dealing things more humanely, I would have thought, when we deal with this
Mm-hmm.
situation. It's a very sensitive situation and circumstances. So, but everybody has rights.
Okay.
So let's not go against foreign workers, right? They are no less than us.
Mm-hmm.
And in a way, a lot of the economy are going to be, let's face it, we are kind of dependent on that.
Mm-hmm.
So we
Yeah.
have
Exactly.
to politically correct as well. Right. So
Mm-hmm.
so I don't have the answer to that, whether those numbers are
No
factored
problem.
in. But
Yeah.
in terms of the expectation, and we have to manage expectation. There's a lot of managing expectations here,
Mm-hmm.
and that's what I say
Mm-hmm.
that why don't we look at it? Um, is there a possibility that the private healthcare, and this is something us, because I'm in the private sector, that we have asked this for a long time ago, that we'll be given the option to procure and get it started and have a parallel program, you see. Let's face it,
Mm-hmm.
there are people who are willing to pay for it as well. And there was a lot of debate. Hey, well, just because you got money and then you beat the queue. No, I mean, we're not beating the queue. It's two separate systems. It's a different thing if it's the same
Mm-hmm.
system and then somebody is paying for it and then jumping queue when somebody has registered and wanting it free. So people have to just talk about it sensibly and put it in proper context. So that's why I feel a lot of the communication messaging that happens around us and even the media must get it correct. Don't put things out of context.
Mm-hmm.
Put it in a proper perspective.
Mm-hmm.
Finish the story. Don't go for headlines. All right, because people are just going
Mm-hmm.
to read the headlines and don't read the whole story. And even the whole story can be just selected and conveniently put in to answer their question when the person or even a VIP or even the minister says something else, but you don't. You just put it to a different question. This is the same the adage that says that, oh, here we are putting now the question to the answer rather than answer to the question. So that's not right. I think
Mm-hmm.
we, the media and everybody else, has to play a, be fair and be very careful in how they report the situation on the ground. So I
Okay.
think if the corporates are
Mm-hmm.
looking at it, obviously everything comes still from the supply from the ministry, and that comes down
Mm-hmm.
to it, right? The supply. So if we can have supply
Yeah.
that goes all around for the corporate through the private sector, maybe, or there's enough people and there are companies who are able to do it, sure, why not? Because I think we do have to ramp
Mm-hmm.
up the vaccination, and so far that's
Yeah.
still the exit route I would have thought.
Okay. Now, Doctor, one question on safety of the vaccines in terms of how quickly they were developed and these kind of things. Uh, Before we get to that question, I just saw a few days ago Phuket has kind of been opened up for tourism. I think 50 different countries are allowed to fly into to Phuket now. Partly because Phuket have gone in and vaccinated so many people on the islands there. Is that a possibility for Malaysia? Let's say for Langkawi, and do we need to be competing with Phuket in this way? Of course, tourism industry has been hammered in the last few months. Uh, what is your advice to decision makers, stakeholders, in terms of creating a dedicated area for tourism that is safe for international travel, and should it be an island if at all?
Yeah, I think I've heard that conversation. I think the narrative has been always creeping up about the tourism is really badly affected, as you said. And I did hear about that and the ideas and the thoughts that to make Langkawi now to bring it up as well for tourists to come in. And I think I think they're working it with. Is it Qatar Airways? I may be wrong, but they are working on it.
Mm-hmm.
Yeah. So I think as long as there are um, people, in a sense, from the healthcare and the professionals and everybody involved in all this discussion, I would have thought, why
Mm-hmm.
not? Right? I mean,
Mm-hmm.
we always talk about economy, livelihood, and I truly understand that. I do empathize because, especially in the last few days, we getting all these suicide stories. That's bad. That's bad. You hear about four
Mm-hmm.
suicides a day. Um, yeah, yeah. I'm in a way, I'm personally traumatized hearing that story,
Yeah.
and this cannot be
Yeah.
going on, and people need help, right? I mean,
Mm-hmm.
but again, the narrative has always got to be positive, right? If we're
Mm-hmm.
going to
Mm-hmm.
be negative, talk it and not find solutions, we'll never get around it. So let's just keep that
Mm-hmm.
momentum going to give solutions. So my thoughts would be, again, being a doctor, being in private healthcare, I suppose
Mm-hmm.
I'm not too sure how much my views are going to be taken up. Personally, it's just
Mm-hmm.
one person here, and then that's me. But if I were to say that we can, and if it's an island because it's well surrounded by water, it's easier to control the
Mm-hmm.
water, the movement,
Yeah.
and that will be it, right? But when you look at that, just look at when things were not the MCO, not the 1.0, and
Mm-hmm.
CMCO, RMCO. People just knew they were, it's going to be closed. Everybody rushed through. It's the discipline, right? At the end of the day,
Mm-hmm.
right? As much as people are tired, we need to have that SOP. We need to do the masking, the double masking, the physical distancing. That I think is the issue really more than anything else. And even now we have to be mindful that people think that once you're
Mm-hmm.
vaccinated, that's it. I'm done. I'm
Safe way.
impermeable. My defense shield. I'm Iron Man, right?
Yeah.
So you know that you can still be infected. A bit that will be just more likely asymptomatic one. or just a mild one, category 2 or K2 as we call it, or stage 2. It doesn't
Mm-hmm.
matter. And so it does the work for the vaccine. Let me just remind people the reason to get it is so that you don't get that category 3, 4, and 5, so that you end up in
Mm-hmm.
hospital. So it prevents hospitalization and death. So I think that's the thing. The question is, does it prevent transmission? That's the big question. And I think the main thing about has to be the discipline in all of us. We all fatigue. We all tired. I do know that, right? I sometimes
Mm-hmm.
wonder myself, hey, when am I ever going to not wear the mask anymore?
Yeah.
Yeah,
And you're
because
a doctor.
WHO has already stated it.
Yeah.
Yeah, WHO has already stated you're vaccinated, you still wear the mask. So let's just go and
Exactly.
take that as
Exactly.
something that's we have to be paying attention to. So yeah,
Mm.
I have no issues about really if that's done and well planned and executed. Who comes in, who goes out, the discipline, the SOPs, that has to be there in place. It's no point
All
bringing
right.
in creating a bubble when then that bubble
Mm-hmm.
becomes a cluster at the end of the day.
Okay, got it, got it. Now, Doc, we have so many questions actually today, and they're going through my here, and I'm just missing some. So I apologize if I miss your questions. Razib has just asked, in recent finding a report from the UAE, people who were vaccinated with Sinovac are being given a booster dose of Pfizer. Do you think this is a good idea? I hope it is because I just got injected with Sinovac a few days ago. So I want to know. And then there was another question around allergies, which is your key area. Um, what is your advice in this two two questions, but also two concerns? I think for the general public out there.
Yeah, I think when you look at it, this heterologous vaccination, right? So that means you mix and match. It's not entirely a new thing, right? It has been going on for a while, even before the thoughts about maybe because of the shortage of supply, and hence let's look at what's available and let's have a look at whether this is going to be providing the immunity that's required. And so
Mm-hmm.
far, I think there are a lot of studies still ongoing, and we have to look at it on our own requirement. I have to say this as well. I think we have to look at our country first. Don't
Mm-hmm.
start looking at others, and it's just the same thing like the Americans in USA. They're just going ahead with the 12 to 18, or rather the 12 to 15, pretty aggressively. But are we ready for that? So those are the sort of questions that we have to look into, and we have to look at our own local situation. So if we are looking, and so far what has been stated by the ministry, from what I read, they are looking at all those studies that are looking with the AstraZeneca and Pfizer, right? So of course, there are
Mm-hmm.
many others now coming across for this question about the Sinovac, and then given as a booster of Pfizer. And it boils down
Mm-hmm.
probably is just about the supply. But if we are doing things, we do need the data for that. I wouldn't just simply just give it just because, oh, we have Pfizer, let's just give it. But where's the data for that? What's the evidence that this is going to be safe, and is this going to be
Mm-hmm.
effective? That's the two things that are always asked. It's always about safety and
Yeah.
effectiveness. So
Now,
I
Doc.
cannot.
Mhm.
Do you think the same protocol should be followed? I who who am I to really say this, right? And unless we have our
Mhm.
own local data, that be best. But because we don't have, and the capacity there is simply because of the cost of running those trials, then we look
Mhm.
elsewhere. And this is where elsewhere is not always equal to what is going to be applicable here. So I certainly would not really comment on that because I'm not seeing the data. But if it was the AstraZeneca and then after that the Pfizer, more data are coming across for that one, and that's what the suggestion was.
Mhm.
And
Okay.
yeah. So, and if talking about the allergies, what specific things are we looking at for the allergies?
How to
Uh,
avoid? Is there anything that we can do to avoid these allergic reactions beforehand? I mean, is it, I don't
okay,
know,
right.
drink more water or something? What is it? Mhm.
Okay, what the uh all right. But let's just go back to when I first came out with my article that was published back in March, 2nd of March, right? So it was there
Mhm.
particularly in Malay Mail, right? So I wrote up the
Mhm.
what we call the allergy risk assessment, right? And it was
Mhm.
picked up as well and with by the ministry, and it was based on the expert opinions and also the recommendation from the committees of anaphylaxis committee of the World Allergy Organization. So if you know you yourself, that person to be vaccinated has an allergy and or rather an anaphylaxis. Now anaphylaxis means it's a severe life-threatening reaction, a severe life-threatening allergic reaction. That means two body systems are involved. Let's say, for example, you get really bad hives and swelling on the face. Now you're having difficulty in breathing, or you're being feeling you're going to pass out because you potentially your blood pressure is coming down and you can go into shock. So if you had anaphylaxis to an injectable drug or a previous vaccine, let's say a flu vaccine, you now are in what I call or we call the high risk group of getting, yes,
Mhm.
an anaphylaxis. If you had a COVID-19 vaccine, particularly your Pfizer, that is the one that has been shown is rare, one in 250,000, very rare doses, and then you can get one
Mhm.
anaphylaxis, but it's easily treatable. That's the other thing to note. So if you are having, let's say, a drug allergy, you just get a little bit of rash, even after an injectable one, but nothing else, and maybe you have also food anaphylaxis, you're in a medium risk.
Mhm.
And then if
Okay.
you just have, let's say, not an anaphylaxis, then it will be, say, it could be allergic asthma, rhinitis, eczema. So you're
Mhm.
under low risk. Now, the difference between low and medium risk means you can take any of the vaccines offered,
Mhm.
all right? But you just need the observation, 30 risk, 15 minutes in the low risk. In the high risk, you need to be assessed by an allergist, someone like me, or there are not many allergists actually in Malaysia.
Mhm.
Not that I know of truly in the public sector,
Mhm.
clinical practicing allergies, I mean. And so they are either going to be in the university hospitals or in the universities or in the private sector. So they need to be referred for further assessment if you have that history. So in a way, you would already know from your background history whether you're going to be a risk. But sometimes,
Mhm.
that is missed and you are reassessed again at the centers. And I'm hearing too many stories that the assessment was not really, in a way, according to what I've suggested. And then when they
Mhm.
are given the date, they are there, reassess on, or if they were the AZ because the my suggestor didn't really ask about that, and assessment is on the spot. And then it's the frustration that comes, hey, I've got a date I'm supposed to be given, I'm going to get it, and only to be told, oh, you need a further assessment because you might have an allergic reaction. So
Mhm.
and actually when I look at these patients who come to see me in the end, and I have to say that actually you could have gotten the injection on the day, no problem at all, just from your story,
Mhm.
because there's no specific test that we would look to assess even in the higher risk, because the blood
Mhm.
test, the material that's found in the I mean the Pfizer vaccine called polyethylene glycol, we cannot test it, right?
Okay.
I can do a skin prick test, but who's going to give me a Pfizer vaccine to do the skin prick
To do
test?
the test. Yeah.
It's a precious commodity now, you see. So there we
Yeah.
go, and there's
Exactly.
no blood test at this point of time in Malaysia. So you
Okay.
can
So, doc.
know what your situation is, and you can now say that, okay, if you have allergic reaction, anaphylaxis, you're in the highest, potentially you should be okay with the Sinovac because it does not have that non-active ingredient called the excipient that's found in the and definitely very much less in the AZ vaccine.
Okay, okay. Now, Dr. Amir, we also have some footage of one of the vaccination centers that we took from the government's website. Can you run through this with us? And just what we're looking at is Stadium Bukit Jalil here.
Okay.
So Doc, what are we looking at here? What is this an open enough space? I mean, it's a huge football stadium.
Yeah, yeah. I mean, Bukit Jalil is right. And I'm not sure whether you're England or a Germany fan. Uh, okay, let's not go down that road. So
Exactly
yeah,
right.
so the all the usual standard station. So it's a little bit enclosed here, really, as you can see. And then from you go to the actual now the vaccination. Yeah, this will be of course enclosed for privacy and everything. So this is the actual vaccine. So this I presume, let me see, still the vaccination. So they're showing where the vaccination station is. And yeah, you're done already. So that last one just now was the observation. Now you're out of the stadium. So if you have seen just now, there's station one. So that be the first time when you'll be greeted basically, and then you will be asked to put in your scan your QR code, and then you will answer and get the questions as the pre-vaccine assessment, and you get your temperature checks, and it's a bit of a triage there. And then after that, you go into two where they will now ask you to scan your QR to confirm your for that date, and that's where you would have um, now just ensured that you have gotten the assessment that you have to fill up in two copies. One you will keep, and one will be kept by the let's call it ministry. And then after that, you will go to station three, and that will be your basically that's where I believe the medical officer now will now check or your assessment. If you tick say no to say severe allergy and everything else, and then you're good to go and to the vaccination, which is station four, and then station five is your observation. That's what I was saying just now. Yeah, I think the usual protocol is 30 minutes, but I do know personally because I brought my mother to IDCC, and so it'd be 15 minutes if you have any if you're in the low risk like what I was saying just now. So
Okay.
and then after that they will check at the exit and make sure that you will click before you leave, because then when you click to say that you have now gotten the the vaccine, then it will come out with the batch number, expiry date, and the vaccine that you're before that also at the observation, on entering the observation, you will be told, you'll be given the card, and you'll be told that this will be your next appointment date, that you have to bring that card. Okay. And then of course it's 3 weeks for the Pfizer, and even the Sinovac. Now initially I thought it was 4 weeks, but it's actually now 3 weeks, and it's 12 weeks for the AstraZeneca at this point of time, although they might be bringing it down to 8 weeks because of the concern about the Delta variant. So that's yes, it's a big open space coming in, but you can see it's a big space. People have to walk and quite the distance and everything. But if you're doing up to 10,000, yes, you do need a space. But as it's almost like going through a toll, right? You converge and it's still a closed space at certain point,
Mm-hmm.
right? So waiting is okay, but the minute after you go into station 3 and then 4 and then 5 looks like it's an enclosed space. So that's why we want to move them fast enough. So
Okay.
my personal experience that from the time I arrived and my mom got the injection was less than 20 minutes. And then the observation another
Mm-hmm.
30 minutes. So that's why it's everything is less than an hour. So that I
Yeah.
think is acceptable.
Now, one of these things that when I went through the program myself, I was like, wow, that's really quick. I mean, there's so much discussion about what goes on and this whole program, and it's just a quickly go in, and sometimes it's just over before it begins. So I think there's a lot of fear amongst people, but I think they just need to just get it done really, and continue to work hard to follow the SOPs. I know it's tiring. Dr. Amir, I know there's a bunch of questions we didn't get to, and I know we've only got you for half an hour today, and we've dragged over a little bit. So I just wanted to take this opportunity to thank you for your time today and giving us your input, especially around allergies, especially around the rollout of the vaccine. Your input and your insights are very important, and I thank you for the hard work you as a frontliner and the thousands of other frontliners out there who are doing. And we thank you for that role that you're playing, and continue to give us good advice and continue to keep us safe as much as you can. So thank you very much, Dr. Amir.
Yeah, it's been a pleasure, and I hope that everything uh, turns out to be better eventually. We have to believe, all right? Believe and be very confident, right? And we will need to help each other here and the riot amongst
Mhm.
us to move forward and believe that we will get out of this sooner and rather than later. So, but we have to play our part, right? So don't start saying and pointing fingers to others. Look at ourselves first and really be truthful. Be true to ourselves.
Mhm.
Believe, be confident that we will get out of this. So get the vaccination, please, and so stay safe and stay sane.
Stay sane.
Look
Yes.
after, yes, look after your mental health. I mean, seriously, this is very very exhausting. There's a mental fatigue. It's just really tremendous, and like I said, hearing all the things, the arms that which are not desirable at all, which is very very sad. It's not how we want it to be going through. So let each other out. So thank you very much, and I hope I've given some information, and I'm always around.
Thank you, Doctor, and we will see. Hopefully, we'll see you again. And thank you, everyone, for joining us. And we will see you again next week on a Working Lunch with Nordin. Thank you very much.
Thank you.